Hi, I'm Susan Ripley, Director of Foster Home Licensing with Heartland for Children. I'm so excited you are joining us to learn more about how to become a foster home. Every child is one caring adult away from being a success story. This information session is going to teach you the basics of what you need to know to decide if this is the journey that you want to take. There is such a great need in our community, so I hope that you will share this information with others. I hope that you learn what you need to learn to get started. And more importantly, I hope we hear from you right after this to get signed up for a class. So come learn some information.
Welcome to Heartland for Children's Foster Care Information Session. We're excited that you're here. In this info session, we will be answering all of those frequently asked questions about foster care and the process of becoming a foster caregiver. Let's get started. Who is Heartland for Children? Heartland for Children is the local not-for-profit that helps children and adults reach their full potential. We are the local community-based care agency that is redesigning the foster care system, and we are contracted with the Department of Children and Families to manage the child welfare system in Polk, Highlands, and Hardy counties. This is also known as Circuit 10. There are many partners within our system of care, such as case managers, guardian ad litem, and the court. Heartland for Children contracts with 3 case management organizations, also known as CMOs, and these CMOs oversee more than 2,000 kids on case plans. The names of our case management organizations are Lutheran Services of Florida, Children's Home Society, and One Hope United. The average caseload of each case manager oversees is 28 children. Now, what is foster care? Foster care actually is when we provide temporary homes for children who cannot safely live with their families. This provides a nurturing and stable environment for the child to heal. The goal of foster care is the safe reunification of the child with their parents and or a relative. Foster care must act as a support system for families and not a substitute for parents. Did you know that 72% of children in care are reunified with a birth parent or placed with a relative or non-relative? We love whenever we can celebrate families healing and being able to be reunified. But there are sometimes cases where that is not in the best interest of the child. And so when children cannot be safely reunified, the case management organization may pursue termination of parental rights in order to pursue adoption. Now, there are 4 different types of foster homes. There's the traditional, which is level 2 through 5. We have medical, specialized therapeutic, and respite. Our traditional foster homes, also known as level 2 through 5, are in a traditional family setting, and the child will stay until safely reunified or find permanency. This foster home requires 21 hours of traditional training. Now, our medical foster homes are trained to specifically help children with significant medical needs. These homes are also licensed as traditional homes first, and then are required to attend an additional 32 hours of medical training. Our specialized therapeutic homes are designed to help our children that have significant mental health, behavioral, or emotional issues. This does require the normal 21 hours of traditional training and then an additional 30 hours of specialized training. For this type of foster home, it is preferred for at least one of the caregivers to be a stay-at-home parent. Our last type of foster home is respite. There are times when a child may need a safe place to stay for a short period of time, maybe a couple days or up to a week or 2. Perhaps even another foster caregiver had a family emergency, or maybe the child has a relative or non-relative just waiting to have their home approved. This foster home license is also requiring 21 hours of training to be licensed as a traditional home. So, who are our foster caregivers? Our caregivers are caring individuals with a desire to help children of all ages and treat the children as they would their own. These individuals are committed to working in partnership with our agencies and with the birth families as well. And they also have a willingness and ability to complete required training and paperwork, as well as pass the required background screenings as laid out in foster care licensing standards and Florida statute requirements. Who are our children in foster care? They are children in your community who range in ages from birth to 21 years old. Many of these children are a part of a sibling group, and they are children who have experienced trauma and need someone to care for and support them so they can heal. They are normal kids who, through no fault of their own, have experienced a life-changing event. Now I want to introduce you to Daniel. Daniel is one of our local dads who hit an all-time low in his life and experienced having his children removed from his care. But thanks to a loving foster caregiver and other child welfare professionals, he got the help he needed to overcome his circumstances and be reunified with his children. Listen to Daniel's story.
When my kids were removed, I was at a point in my life where I was physically dependent on opiates. I was also using methamphetamines daily. Got in a fight with my girlfriend at the time, and DCF got involved, came to the house, and they asked me to take a drug test. And I told them I was just gonna be honest with you, I wouldn't pass my drug test. And kind of things went from there. Kids were removed. Once my children were removed, I went into a very dark period of my life where I just quit caring about myself or anyone or anything. I gave myself completely and wholly to my addiction, and that's all I focused on every day. I completely lost myself, lost track of time, and had no thought in my mind that I would ever see my children again. What changed for me, I had a court date coming up, about to go back to jail for the third time, and a van pulled up with my case manager in it, whom I've never met, and I don't know how she found me there. When Sheriff's Department couldn't find me and bonds agents couldn't find me. And she said, look, if you want to get your kids back, get in the van, and we're going to court. And I didn't think that that was even an option. I thought it was so far beyond that it wasn't possible. She gave me out options that I didn't think I'd had anymore. She said she could get me into a program, start working my case, and she gave me hope that I didn't know I had. She would take me to my court dates. She got me set up into a rehab program. She picked me up and took me to the supervised visits with my kids. She really kept me on the straight and narrow and let me know what the next step was to do from where I was at that time, from week to week. And I actually saw finally some light at the end of the tunnel. The foster parents played a huge role in making sure I was successful. My youngest daughter had autism, and her foster mom taught me so much about how to deal with it. And she made sure that if there was any kind of family function of hers that my kids would be attending, that I was invited also. Her support group became my support group. Her friends reached out to me and made sure I was invited to all their activities too. And that meant so much to me. When I was sitting in rehab by myself, she reached out to me and let me know daily, how my daughter was doing, what she was going through that day, if there was anything else going on, made sure that I was always included. And I had a connection there with my children again. It was amazing, and we're still friends today. Now in my life, I'm married. My wife has 3 kids, and I have 2, so we have 5 kids now. So I went from being by myself in a dark place to always being surrounded by smiling faces. I work at Amazon 40 to 60 hours a week sometimes, and I'm currently taking CDL classes through Amazon. Hopefully gonna start making some more money soon. 4 years clean, maybe more. I've honestly stopped counting. I don't feel like I was ever that person at all. It's like it was just a bad memory or a bad dream. If there's any parting words I'd like to leave to a parent that's in the same position I was in, don't be afraid to connect with the child's foster parent. A lot of cases they want to meet you. Maybe if you burn all your bridges with your parents or with your family, you can do like I did and get a good support system that way. Their friends became my friends, and their family's still there for me today and for my kids. There are people out there that will help you and that want to help you. Reach out, find your case manager, get you into a program, something. There's all kind of things in place that can help you. You just have to reach out to them. Don't be embarrassed, don't be scared, just do it.
Hi, we're the Spibes, and we are currently foster caregivers, and we have 4 biological children of our own, and we have 4 foster children. We have been doing it for almost a year now. We decided to become a foster home because it's something that I've always had a desire to do, and then we have a friend who told us there was such a need for it in our community, so we decided to look into it. We have 2 biological children who have gone off to college, so I felt like I had a lot more time now and we had the space for them.
Our kids were very excited to do something like this. They're 14 and 15 now, and are working in the community a lot with volunteer work, and they are very excited to help with that.
If you have kids and you're thinking about bringing foster children into your home, I highly recommend it. It helps your children see the world up close and in person instead of through a textbook or through a computer. It gives you experience and also shows them how to lead and be a role model for these kids.
Some advice I tell other people who have kids about becoming a foster home is that their kids are going to learn so much from this experience. They learn how to deal with people that have special needs maybe. They could learn about other cultures, maybe other ethnicities.
And I feel like you need to just go out and try it. Go to the classes, you receive so much information, and it really opens up your heart, and you really get excited to do it, and you really want to be a caregiver because you realize how much it's going to do for the children.
It's a very exciting time in order to help a family, and it's very, very enlightening and brings your own spirits up in order to help somebody like that.
Our journeys of fostering was somewhat unexpected, I guess. As a reader of the Bible and a follower of Jesus, it's hard not to see the calling of caring for the least of these and for orphans.
We spoke to our kids just about how foster kids are just kids and they need a safe place to stay while their parents can't take care of them. And our boys have really done well with it.
I like to play with them and make them feel happy when they're sad. It's basically like meeting new friends, like taking friends to the beach, but you have them for longer.
One question we get asked a lot is, how has our life changed fostering? And I would say not a lot in terms of the activities we do. We take the kids on vacation, we take them camping to the beach, and it's a lot of fun to allow these kids to experience things for the first time.
If you're considering foster care, I would recommend that you either reach out to Heartland, or if you know someone that already is a foster parent, definitely reach out to them. I would definitely say don't hold back out of fear or nervousness about something being new. Give it a try, because I think you'll find that they're really just kids, especially if you're already a parent. It's just parenting kids that need love and care and need a place where they know that they're valued and important. Also a place that's rooting for their family to get back together.
We are the Prickett family!
This is our foster daughter from last year. She was in our house for her senior year of high school. Why was it better to go to a foster home instead of a group home?
I think because I got to still do the things that like I was already involved in. So I was involved in like chorus and ROTC and my church, and I was able to like go and do those things, and I didn't have to put those things off or like not do those things because other kids had other needs that needed to be taken care of.
Did you enjoy living in our house for a year?
Yes.
Why?
Well, even though I definitely woke up at 7 every morning from screaming kids, it was still a lot of fun just because, I don't know, I got to be a part of a crazy family for a year, and it was like, I don't know, it was really good to be in a stable house and have tons of support and people encouraging me.
Do you ever see us again? Do you stay in touch?
A lot. Constantly and every day.
Not only are you a student, but you also have a job.
Yes.
You bought your first car.
Yes.
You
Pay for my phone.
Pay for your phone.
And all my insurances except for medical.
Right? And you're doing all of the adult things.
Yep.
Supporting yourself through school.
I am.
Got a scholarship for your academics. We're so proud.
Thank you.
Did you know that there are all kinds of supports available to our foster caregivers? There is a monthly board rate, which helps offset the cost of having a child in your care. This helps cover items such as clothing, food, and other items that the child may need. Here you will see the breakdown for the board rates per age group for children. Did you know that each child in care receives Medicaid? This covers the cost of dental, medical, and any other community mental health needs. There are also even more supports for our foster families. Each new foster home is actually assigned a foster parent mentor for the first 6 months of being licensed. These mentors are experienced foster caregivers who will assist you in navigating your first year of being a foster home. We highly recommend you connecting with your foster parent mentor whenever you have a question or any concerns. They are resources just for you. There's also respite care available for our foster caregivers, because we know there are times when foster caregivers may have an emergency or might just need a break. Respite care is available to you whenever necessary. There also may be times when a child is needing some outpatient or in-home services. So there is counseling and other support services available for all children in care, and these are easily accessible. All of our children in care qualify for subsidized daycare if both caregivers work. Each of our foster families will be assigned a relicensing specialist to walk with them throughout their foster care journey and be a point of contact for questions, support, and to help keep your home licensed. We are grateful to live in a community that cares, and there are many local foster groups, organizations, and churches that want to support you, our foster families. There are donation centers, support groups, and foster family events happening throughout the year. So now let's talk about some of the common questions, such as, how long will children stay in our home? Our goal is 12 months or less. Some children may stay for just a few nights, others may stay much longer. Another question is, how many children are placed with their siblings? Right now, we have 59% of children that are currently placed with their siblings in care. Our goal is to be able to increase that percentage so that most, if not all, of our siblings can stay together. Can we take them on vacation with us? The answer is yes. Children are permitted to travel with their caregivers as long as there's proper notification and required orders are in place. Some foster caregivers have taken children on cruises out of the country and to the mountains, and we love for our kids to have all of these experiences. Can we have pets? Yes. Pets are great for children. Licensing staff will do a general assessment of your pets when we are in the home. What happens if they can't go home? A decision may be made to terminate parental rights if the parents are not successful in completing a case plan. Upon termination of parental rights, the children become available for adoption. Do foster parents adopt? Yes, foster parents do adopt. Last year, only 19% of Heartland for Children's adoptions were with foster caregivers. On average, we found that foster caregivers foster for 3.5 years before their first adoption. Although foster parents do adopt, we want to emphasize that the main goal for foster care is for our local families to be strengthened, healed, and reunified. We want our foster families to cheer on our biological families so that we can see more success stories like Daniel's. If you know that your main goal is to grow your family through adoption, we suggest you contact our adoptions team to learn more about our adoption track. Their phone number is 863-519-8900, extension 223. Another commonly asked question is, do the kids change schools? And the answer is, before a child can change schools, there is a team assessment that needs to be completed. Whenever possible, we try to maintain a child in the same school so that they can keep those connections with their friends and teachers, and it is less traumatizing for them. Now, here are some of the facts. As of August 2022, there are currently 331 children placed in licensed foster homes across Polk, Highlands, and Hardy counties. We also have currently 205 licensed foster homes in these 3 counties. Now, there are 101 children in residential group care placements that are waiting to be in a family setting of a foster home placement. Therefore, we currently need 45 more homes to be able to meet our goal of having 250 foster homes in our network. Are you ready to meet this need? Here are the steps to becoming a foster caregiver. The first is to pass the preliminary screening completed by phone and watch this information session. So chances are you've already called us. But in case you haven't, you can call us at 863-519-8900, extension 289, and someone from our team would love to connect with you and answer those questions. Next, the step would be to sign up for a class and attend the 21 hours of training, which includes background screening. And then the final step would be to complete the home study and licensing process. We pride ourselves in licensing our families within 30 days of completing class, and we have a licensing specialist that will walk you through every step of the way. Now, a little bit about our training and licensing process. Currently, our classes are being held virtually through Zoom, and they are only 3 weeks long. We do have a weeknight class, which would be on Tuesdays and Thursday nights from 6 to 8 p.m., and we do also have Saturday classes for 3 consecutive Saturdays from 9 a.m. to 4 p.m. New classes are starting every month, so it's easier than ever to get licensed. Now, each caregiver must be present and also on camera during these classes. Due to the nature of the training material, children are also not permitted in the training classes. Licensing documentation will be required and home visits completed. Now it's time to get signed up. Prior to class, someone from our team will connect with you to schedule a home visit. Please ensure to communicate your availability back to us. If you have any questions or are ready to sign up for a class, please contact our team at 863-519-8900 at extension 289. Thank you so much for taking the time to learn more about becoming a foster caregiver. We really hope to hear from you soon.